Hi, everyone. Happy New Year and welcome back to the first episode of the Brainiac podcast for the year 2022. I think this is going to be a really special episode for a couple of reasons. The main one being that this is being recorded on Bell Let's Talk Day, which for those of you who don't know, is a campaign that happens each year in Canada to spread awareness and raise funds for mental health. And seeing that there's going to be a lot of important conversations about mental health happening around this time of year, I thought it would be really fitting to discuss concussions from a mental health perspective in terms of some of the psychological outcomes of concussion, what may cause them, and how we can support the mental health of athletes or individuals that have been concussed. And on top of that, given our guest's unique experience, we'll also talk a little bit about the world of concussion policy and the importance that that plays as well. And so in saying that, I'm so thrilled to be joined by Sandhya Mylabathula. I've been really lucky to get to know Sandhya a little bit through some extracurricular activities over the last year or so. And I'm so grateful that she's taken time out of her busy schedule to join us today. So thank you so much, Sandhya, for coming on today.
Thank you so much for that very kind introduction, and it's an honor to be here and such a pleasure to be chatting with you today.
Fantastic. So I'll just give a little bit of a bio for Sandhya so our listeners can get to know you a little bit better. So Sandhya is a PhD candidate in the Faculty of Kinesiology and Physical Education here at the University of Toronto and a returning Canadian Institutes of Health Research Fellow in Public Health Policy. She has examined policy, risk factors, education, sex and gender considerations, and management as they relate to concussion, and her current research focuses on the recovery experience of concussed students. On top of that, Sandhya and her twin sister also work together on a project called STEAM Sisters, which aims to engage youth in science, technology, engineering, art, and math through hands-on activities and digital and broadcast media. So Sandhya, thank you again for coming on.
Thank you.
And so let's start with a bit of an icebreaker before we hop into maybe the bulk or the more serious points of our conversation today. And so seeing that this is the first episode of 2022, I want to start by asking you for three things that you're hopeful for this year.
Ooh, okay, yeah, this is such a great way to start. Okay, my first thing that I'm hopeful for is definitely the end of the pandemic, for sure.
Mhm.
So it's obviously taken a toll on everyone in so many different ways and impacted so many lives. So definitely hopeful for that to end. Big thanks to all the healthcare and frontline workers who work so hard every day on those stuff. I'm also hopeful so I've been pretty active with my sister on concussion policy and education, so I'm hopeful to see more progress on that front. I also hope to graduate at some point soon. I'll also throw in there, I want to succeed in my goal of cooking something from every province and territory in Canada,
Ooh,
because that's my way of traveling without traveling during the pandemic.
interesting.
Um, I think I've surpassed three here, but I'm just gonna throw in one more. I hope the Leafs win the cup, knock on wood.
Yep, I'm with you there. I'm with you there. I think a lot of people in the city and around Canada resonate with a few of those. So those are some great hopes. Definitely
Thanks.
share a lot of them. And so now let's sort of get into the meat of today's episode. So we're kind of dive into the psychological aspect of concussion now. And I know this is a bit of a broad question to start with, but we can start here and maybe get a little bit more specific. So what are some of the common psychological outcomes that those with a concussion might experience following injury?
Yeah, so it's interesting because it's almost like a double whammy with concussion where it's an invisible injury since we can't see that the person's injured, but with the psychological consequences similar to other mental health concerns, it's also invisible. So this has, I think, in part contributed to the fact that psychological outcomes after concussion have been overlooked, which is quite problematic, as it can be some of the most difficult and debilitating effects of the injury and could leave people who are injured suffering even more. And so we know that in terms of what that actually looks like, the experience of a concussion can vary from person to person because it's a very individual injury experience. But some of those concerns can include cognitive, emotional, behavioral symptoms, and that could mean irritability, confusion, feeling off, experiencing like unusually emotional, nervousness, sadness, depressive symptoms, for example. And it can even go even beyond that, like fear of the unknown, tension, anger, grief, loss of identity, fear of reprisal at work or at school, being disconnected from something that that individual has relied on in terms of familiarity and something that they're used to doing. And then even worrying about like mental health or health in other ways or just overall health. and what the injury means for that, especially with things like chronic traumatic encephalopathy and other terms like that being thrown around as hot topics. Yeah, I can go further into that in terms of for athletes. Like there are studies that show that at least 20% of athletes experience depressive symptoms after a concussion,
Mhm.
and age might also play a role in that. But we do need more research to kind of really understand how that factor influences this. And athletes are also known to have very particular experiences in terms of increased fatigue, decreased vigor, increased negative mood, as we've just discussed, compared to athletes with other types of injuries. And that fatigue could be related to cognitive impairment, depressive symptoms, even disturbed sleep. And that can just kind of become quite a cycle as well.
Absolutely. I think some of those points that you made about like just the fear, the unknown aspect of concussion is sort of, it can be a big driver of some of these outcomes, and not a lot is known by a lot of people about sort of concussions and what can come with that. So I think that was a really great point. And just kind of building off of that, based on kind of what you've learned over the years and some of your own research, is there a period of time following concussion where these types of outcomes may be more prevalent? So, for example, is someone more likely to experience them within those first, maybe, let's say, 2 to 3 days after concussion, or is it maybe more likely to experience them if recovery isn't going well and then concerns begin to grow from there?
Yeah, it's a really good question. So I think it because it's such an individual injury, it can vary and it can depend on the person and their specific individual context. So we can see both acute sort of and longer term psychological
Hmm.
effects there of a concussion. And I would say that across the board, from what I've seen personally, they are all of those are not quite as well as addressed as other aspects of the injury, such as the physiological side of things. But I do think things are starting to change and there's still a lot to be done. So I would say that fear, that frustration, I've seen that immediately after the injury. What is this injury? What does it mean for the individual? It depends on how much they've heard about a concussion before or not. And then kind of further along the line, uncertainty. When will this recovery experience end, and what's going to happen to this person? Can they reintegrate into their normal previous pre-concussion life, as well as they hope to? Those sort of things I'm seeing in my research now. Um,
Hmm.
yeah, and it's really spans across that entire period.
Yeah, I think the common theme that we've kind of, touched upon only in just these first few minutes is that it's a really an individual injury, and
Yeah,
it's like not a one, you can't sort of paint all concussions with one brush, so to speak. Like everyone has different experiences, and that can kind of make it even more difficult to work through from a clinical perspective too, I'd imagine, just because we really need to know what's going on, because you can't make assumptions or you can't generalize things a lot of the time, which is kind of a
absolutely.
quirky thing about concussions in comparison to other types of injuries.
Absolutely. And even if somebody, knows somebody else who's had a concussion and engages with them, speaks to them about their experiences, I think it's still a good way to learn about what a concussion can be like.
For
But it
sure.
doesn't necessarily mean that the other individual will experience the same thing. So that can still play a role in terms of the psychological aspect of the recovery experience, because it can still be isolating and frustrating and give that sense of uncertainty.
Definitely, definitely. And now let's just turn our focus to athletes just for a second here. And
Mhm.
it's known for concussions that biological recovery can in some instances lag behind clinical recovery. Is it the case, in the same case with psychological aspect where most of an athlete's physical or cognitive symptoms might be normal and return to baseline, and so they're able to return to play, but they might not be feeling right or back to normal mentally. Is that something that can happen or commonly happens with concussions?
Yeah, in my experience, I would definitely say that I've seen this, and not for everyone, but
Hmm.
it's definitely something that we can see. So the clinical recovery might be achieved when a person is deemed able to return to their normal activities, whether it be work, school, sport, by somebody with the appropriate medical authority. But we can still see those lingering psychological concerns for some people. That can include what we were talking about before in terms of fear of return to sport or work, and that could be due to fear of re-injury or feeling that they're just behind others, on their team or at work. Um, Ongoing anxiety in terms of what they were experiencing previously, depressive symptoms that don't necessarily just go away super easily. So it's important to be aware of that for someone who is making that transition back to work or school, sport or school, so that we can make sure to make that an environment that is more welcoming, that is going to be the easiest transition for that person back to whatever activity they're returning to.
Hmm. And I'm just thinking about this now. If an athlete's returning to play and they're not maybe psychologically ready, maybe physically ready, but they're not psychologically ready, could that put them at a risk for, another injury or poor performance? And if that's the case, should we maybe change how we sort of analyze or assess return to play? And maybe psychology should have, or the psychological aspect should have, more influence than it does currently.
Yeah. So anecdotally, at least, I would say that I have seen this, and I am I actually am very pro doing something like a psychological assessment before,
Hmm.
if possible, for athletes that might be possible. Of course, I think there are ways that needs to be looked at in the research as well, in terms of is that what's the most appropriate approach to do something like that? Because if we can do that afterwards, like you're mentioning, there are certain things that we can look at in terms of social support or the lack of that, or different things that we can aspects that we can look at in terms of seeing what does this person actually need and what can we put in place for this person to make sure that they are able to return at a level that they want to.
Absolutely. And sort of on that note, I think this is a perfect segue into sort of the support aspect of it. So I want to now focus on how patients who experience psychological outcomes again can be supported. So based on what you know, is it, and I assume the answer to this is no, but is it more of a waiting game for these symptoms to subside, or are there things that we can actually do specifically, like certain interventions that can help to relieve these symptoms and maybe make one more psychologically ready to return to work, school, or sport?
Ooh, okay. This is a really good question. And yeah, so the general approach to concussions used to be, as you know, more of a waiting game, like with literal complete rest, mentally and physically in a dark room. But as we move away from that, I think the same goes for the psychological side of the injury.
Hmm.
We shouldn't just wait and let people suffer. We need to find ways to help and intervene and give these injured people the tools to succeed and feel supported. And the research tells us that the way an individual responds to injury and the injury experience can be influenced by several factors. If we're talking about injury just broadly here, and those can include like personal factors such as coping skills and external factors such as influences from others in their lives, or something like access to rehab or access to resources. And while the research is still ongoing in terms of how this applies specifically to the concussion context, I think we can still find ways to start intervening and trying to address those psychological effects that we're seeing now, and not waiting for the best approach to be found, because people are still suffering from that now, and I think we do need to do something now. So
Absolutely.
we and so we know that exercise can definitely help improve mood, among many, many other things, of course. So that's a really big one, I think, in terms of the overall recovery from a concussion. But there are other techniques that are maybe less researched, but again, I think where there's a need, doing something proactive to help while not causing further harm is a reasonable approach to take.
Hmm.
And so I don't know if you can hear the phone, I'm sorry.
No worries. No worries.
Can you hear it? Do you want me to
No,
pause?
no, it's all good.
Oh, okay. Um, so what was I saying?
Talking
Oh,
about
yes.
exercise and then some
Mhm.
less research, but still possibly
Oh, yes.
beneficial aspect.
Yes. Thank you. So there is some research on satisfaction with social support, being helpful to decrease negative mood states, and particularly anxiety. So I find this one particularly interesting because it's not the support system necessarily itself, but what the concussed person feels about that support
Hmm.
system. So whether they're actually satisfied with their need for support, or do they
Okay.
actually feel supported. And that social support system for an athlete, for example, could include family, friends, teammates, and sometimes also include like trainers, coaches, and other team staff. But if somebody is a teammate or a friend of somebody with a concussion who's an athlete, I mean, that's something to keep in mind to make sure that you are able to provide that support as much as you are able to for the person in
Hmm.
your life.
And sort of touching on the idea of social support, which I've actually noticed is coming into like the literature a lot more recently, which is great.
Mm-hmm.
What are some of those things that an athlete or a person with a concussion would look for out of their close social support network to sort of help them through that injury?
Yeah, okay. So I think if you are somebody who's a family member or a friend of someone
Hmm.
who's had a concussion or a teammate, being aware, being educated, seeking that education yourself, being supportive, asking what that person who has a concussion needs, while also balancing how you know that person and not overwhelming them, because that could be a bit of a delicate
Yeah.
balance there. Being a resource and knowing that flexibility can be really, really helpful. And just being genuine with your support,
Mhm.
I think, is really important. And letting the concussed person guide that sort of process, but making sure that they know that you're there for them. And then helping them to do the things that they enjoy to do, while making concerted efforts to include them in ways that they can participate in trying to keep them connected. So, like in a friend group, sometimes if a friend group tends to go out and do things sort of that includes more sound and that sort of thing, one of the common
Mhm.
effects of a concussion is sensitivity to sound. So,
Yeah.
trying to maybe keep in mind that, okay, this person in the friend group can't do those things. So, how can we keep them included? How can we modify what we do to make sure that there's some level of support and they're not going to feel isolated and kind of frustrated and alone?
I think that's fantastic. And also kind of as you were saying it, I couldn't help but think like that's sort of sounded exactly if I were to ask you a question, not somebody who has had a concussion, but someone who's experiencing any mental health
Mm-hmm.
issues or mental illness. It sounds like social support is, just being there for that person, understanding what they need and doing your best to be there in a genuine way. I think there's a lot of overlap and it makes sense that that
Yeah.
would be the case as well. Just, people who, need a little bit of help. It, goes a long way just to be yourself and be there for them in any way that you can. I think it's a pretty important lesson to take away for somebody who,
Yeah.
if you know somebody has a concussion or anybody who is experiencing any sort of difficulty or with their mental health as well. So I think Bella, let's talk to you. That was a really great point that you made, and I really appreciate that point as well.
Yeah. Yeah. No, it's so important to be there for other people and kind of if we're there for each other, I think we can do a lot of good.
Absolutely, absolutely. And so just keeping an eye on the time here, we'll wrap up with another conversation, kind of switching gears here, but I'd be remiss if I didn't ask you a little bit about your work in concussion policy, because I find that to be honestly really, really fascinating. So just start with a bit of an intro question. So where did your interest in like policy work come from? And then how did you get started in this area of concussion work?
Ooh, okay. So I've been really excited and honored to have the opportunity to work on concussion policy, something that's super close to my heart. And
Mhm.
I've been doing this with my sister. I'm a twin, and my sister is a an MD PhD candidate at the Institute of Medical Sciences at U of T. So we actually got started in this field way back in the day by working on proposed legislation at the federal level. So beginning in 2010, and we consulted on Ontario policies. So we're longtime advocates on concussion issues, and we do a lot of science communication as well as the STEAM sisters, and we bring in a lot of that concussion stuff through that as well.
Fantastic. So you did mention some of those pieces that you worked on. I want to just probe a little bit further into each of those so you can kind of tell our listeners what those projects were involved. So one of those pieces that I came across during my preparation for this episode was that piece of policy that you put together with your twin sister was called the Pan-Canadian Concussion Strategy. Is that correct?
Yeah, you did your homework.
Can you maybe walk us through what that was and sort of maybe how it progressed and then where it stands now, if it's still, being discussed in
Yeah,
legislation?
absolutely. Yeah, yeah. So kind of if I take it from how it progressed, like where it started was our interest actually from our love of the coolest sport on earth, also known as hockey. So we're super passionate about it. We love to play it and watch it, and it really struck a chord way back in the day when we learned about the story of Paul Correa, for example, and many others whose careers were really affected by this invisible injury. And so we started to read more about it in the literature, and when we had the chance to write policy or proposed policy. And I learned a lot more about it in a course that I took at U of T called Sport Medicine with Dr. Doug Richards, which is an
Hmm.
amazing course. And we continue to just talk to Canadians with concussions, and we realize it's an injury that goes far beyond sport. So that's a big piece of this here.
Yeah,
It's not just sport, it's injury at
definitely.
work or home or, yeah, at school, on the
Hmm.
road, or anywhere really. Um, and so, because there wasn't any policy or regulation in place in Canada at the time, we were really kind of inspired to address that ourselves to write up this pan Canadian concussion strategy, which is um, we started through proposed legislation, and we recognized that there was a real gap in policy. So after speaking to thousands of Canadians and internationally as well, of people who had concussions or knew people with concussions or in some way were affected by this injury, we researched the gaps in policy. We got a petition of over 6,000 signatures signed.
Wow.
um, it was such a good experience to and a very moving experience to be able to
Hmm.
talk to these people who had concussions and hear their experiences and hear how these things had affected their lives. And yeah, so we also were very lucky to travel the country and internationally to share our petition and our idea. So it ended up as a private member's bill in 2014 in the House of Commons in Ottawa, supported by Member of Parliament Dr. Kirsty Duncan, who was such a pleasure to work with. And our strategy was comprehensive and it addressed many aspects and facets of concussions in Canada and beyond. Um, but I can summarize that a bit by saying that our bill asks the government to do three specific things. And these include implementing a National Concussion Awareness Week, a national strategy to address concussion in terms of awareness, prevention, diagnosis, and management, as well as a Center for Excellence to promote research and ongoing evaluation of policy, especially since, as we know, this is such an evolving field and it wouldn't make sense for policy not to evolve with it or to be static or something like that.
Sure.
So yeah, we continue to work on this issue, and part of that for us is to continue the conversation about it. And you're doing a fantastic job of that here, so that's super
Thank
awesome.
you.
And in continuing that conversation, we do that in schools or in events with the general public, but also still with the government. So just before the pandemic, we were asked to provide our recommendations to the subcommittee on sports-related concussions in Canada. So
Oh,
we were
wow.
there. Thanks.
Wow.
It was a
That's great.
really it was a really interesting experience. We were there representing researchers and policy consultant perspectives, but also as individuals
Hmm.
with the experiences that we had. And they also spoke to other researchers and athletes and clinicians. And so there was a report that was published of the recommendations, and we were super delighted to see that the report included some of our original recommendations from the bill. So that includes like the Concussion Awareness Week, which now exists, an expert advisory
Wow.
board, and the collaboration between provinces and territories and the federal government to ensure that there's collaboration and discussion going on here, because again, it's not a static field and we
Hmm.
need to see that movement and to ensure that we learn from each other as well.
Wow. I think that's honestly such an incredible story and honestly like quite inspiring the way
Thanks.
you and your sister sort of took a passion that, from watching hockey to recognizing there's an issue here and then actually creating, tangible change in our country. And I'll get to it in a little bit in our province too of Ontario, which is, it's honestly just so
Oh,
incredible.
thanks.
And like, it's
We were
really,
really
really
lucky.
inspiring as
We
well.
were really lucky to have this experience and this opportunity. And it takes a really long time to work
For
in the
sure.
policy field. But we were just so motivated, I think, particularly by the stories that we were hearing from Canadians and
Hmm.
others and how these things affected their lives. And it was just very, very motivating to want to do something about that and try and help.
For sure. I guess it's, one thing for you to care about something personally, but then to sort of see that other people have been affected by this thing that you care about and that there's really a need for change. I only imagine how motivating it is to like want to then put that into action and create change. And the fact that you've been able to do that is honestly great, really great.
I think you put that really nicely, and thank you. I think you put that really nicely in terms of seeing that need for change because it was something we could see when we were talking to people about that passion about the topic and how it really affected them, and it really kind of highlighted and emphasized that
Mhm.
Canadians wanted to see change in that area and needed something, and we needed to see some policy change there.
Certainly. And speaking of, policy change and something, the last thing that I want to talk about before we sort of wrap up here is that I saw that you had consulted and helped inform a piece of concussion legislation in Ontario called Rowans Law. Can you give a brief introduction to Rowans Law and what it is for maybe those who are unfamiliar, and then sort of give us a brief description about how that opportunity came about and how you were involved in that process?
Yeah, absolutely. So maybe I can kind of make a bit of connection to the bill that we were
For
working on
sure.
federally. So our private members bill that started way back when and was introduced in Parliament federally in 2014, and later the same year, Ontario became the first province to have some sort of policy in place in terms of a policy program memorandum 158, which was what it was called. on behalf of its Ministry of Education. So yeah, we were really honored to be able to help on that. We were asked to consult on it to provide our thoughts and perspectives and I guess expertise on what was needed in this type of policy. And this policy directed school boards across Ontario to implement things like concussion awareness, prevention, identification, management, and training programs in their elementary and secondary schools. And I think it's certainly wasn't perfect, but definitely a good step in prioritizing the problem. Very good step in the right direction. And so this what we call PPM 158, as it was known, became Rowans Law in 2018. So that is legislation that's named after Rowan Stringer, who was a secondary school student and rugby player who had multiple unmanaged concussions and tragically died, which is a terrible, terrible situation and a tragedy. But after that, the law became known as Rowans Law, and it now describes new requirements for both sport organizations and school boards. And I think kind of the overall idea here is that with something like this in place and then continuing to update it, hopefully we'll never see something like Rowan's story ever again. And so some of the pieces that we're seeing with this legislation is a requirement for sport organizations to confirm awareness of concussion resources, to do things like establish a code of conduct to avoid risky behavior, trying to convince people to have that sort of culture shift away from that sort of behavior, and to establish a removal from, but also return to sport protocols for these student athletes to follow during recovery. And then in terms of the school boards, new requirements such as training and education for sport officials, again, codes of conduct and concussion tracking as well, which is super critical for us to be able to tell if the problem is even getting better.
Absolutely.
Yeah. And so there's been some great reception for Rowan's Law. And I think people might recognize some of the awareness tools from like commercials on TV or on social media or something like that.
Sure.
But it also means that there's like tangible tools to support education in the classroom. And again, a long way to go, but at least this provides some sort of consistent expectations for addressing the injury. And hopefully, again, never to see a story like Rowan's ever again.
Yeah, that's for sure. And I think, funnily enough, when you mentioned the idea of actually sort of seeing things around, I think it was a couple of years ago. I was actually at a hockey rink and I saw an advertisement on advertisement, but on the boards, they have like advertisements on them.
Yeah, like
It was
one-off
one,
posters.
yeah, it was one for Rowan's Law, and I was like, kind of came full circle. I was like, holy smokes, it's actually like
Yeah,
really cool to see this out and at hockey rinks and just have that, funnily enough, that invisible injury become now visible for everyone to
yeah,
kind of learn about and just have that increased awareness of. And I think sort of just that's sort of my piece of Rowan's Law, kind of how it's come to life for me in my own, you know, playing
experiences.
hockey and experiences. Yeah, so
Yeah,
it's just really
so
interesting
well
that
put.
you, sorry.
Yeah. Oh, sorry, I was just saying so well put in terms of, yeah, that's creating the discussion around it. So it's making the
Absolutely.
invisible more visible. Absolutely. It's something that is so important to see. And yeah, it's a really cool example of it there.
Mhm. Yeah, it's just really cool to actually be able to talk to somebody who was involved in that and sort of show that there's like a path for people who are passionate about concussion to make change. Again, as I said earlier, I think that's sort of a really big takeaway for those listening, and even for myself who would like to see, concussion more recognized in policy and just around our
Yeah.
general day-to-day life. I think it's just great to get your perspective on that, and hopefully people take some important
Thanks.
lessons from what you had to say today.
Thanks.
So I think that kind of brings us to sort of the end of our episode, again, being mindful of time. So that was, so great to get your feedback and your expertise on these topics, and, taking the time to come on to talk about the psychological aspects of concussion. And again, like we just finished with this policy side of concussion work that maybe doesn't get a lot of recognition, but as we know is extremely important. So thank you again for taking the time to come on.
Yeah, thank you so much. I'll actually just add one more quick thing, maybe because it
Yes,
very connects
absolutely.
very much to the topic of today. Just recently, in last fall, coming back to the concept of psychological impacts of a
Mhm.
concussion, I had the chance to be present, I guess, as a researcher and policy consultant with experience in this area, for an announcement from the government of Ontario where they were talking about strengthening the commitment to athlete safety in terms of investing some sum of money with the Canadian Mental Health Association of
Wow.
Ontario to help raise awareness of how concussions can affect mental health and to
That's
improve
wonderful.
education. Yeah, of these like psychological consequences of the injury. And again, I think, I mean, that's a good first step, and there still needs to be a lot more done, but it's good to see these things are starting to happen. And yeah, I think that was an important step.
Yeah, for sure. Definitely a cause for optimism. Then in that case, I wasn't even aware of that. So that's wonderful. And thanks for sharing that
Yeah,
with us as well.
of course.
And so just before we wrap up, I wanted to give you the opportunity to let our listeners know maybe where they can find you and some of your projects on social media if they'd like to continue following you and the great work that you've been doing and will continue to do.
Well, thank you very much. Okay, so alongside the work that I do on concussions, I'm also an educator and science journalist and podcaster and Instagrammer, and do digital media stuff, and a science advocate. So in terms of concussions, you could check out a couple of recent talks that my sister and I gave, one for the Toronto Science Policy Network and another for Exploring by the Seat of Your Pants, which is a great name. Both
It
of those
is.
you can find on our YouTube channel, which is the STEAM Sisters.
Awesome.
And you can also follow our adventures in science, technology, engineering, art, and math on Instagram and on YouTube, where we just launched season 2 of our new show, which is called the STEAM League, which features superheroes in STEAM and which is kindly supported by the University of Toronto Affinity Partners, Manulife, and TD Insurance. But in any case, please check it out on YouTube or on Instagram.
That's wonderful. Thank you for letting us know about those. I'm sure people listening who enjoyed our conversation will be quick to check those out. So thank you for
Thank you
sharing
so
that.
much.
And with that, I think that brings an end to this month's episode. So I just want to thank everyone so much for listening. I hope everyone has a great 2022. And lastly, don't forget to follow us on Instagram as well at concussion.can.toronto. Thank you so much again, and see you next month for a brand new episode. HeadCheck Health bridges gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Trek Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more. The music at the beginning of this podcast is by Ben Sound, www.bensound.com.